Hi, I am Dr. Khurrum Shaukat Yusafzai. Today's video is about the very common question which everybody is asking is about oxygen toxicity, or when you take a lot of oxygen because of the hyperbaric chamber, what will it affect on your body? So, before I explain about the oxygen toxicity and its treatment, first I would like to explain something about certain things which happen to the human body because of hypoxia or anoxia. Like, I would explain the difference between hypoxia and anoxia, and then I would explain the opposite, which is hyperoxia. So hyperoxia leads to oxygen toxicity. So today's video is about all of this. I hope you enjoy. So let's begin. The objectives of this lecture is to understand hypoxia and anoxia, as well as its opposite, hyperoxia, and due to hyperoxia, the resulting oxygen toxicity. To know about the composition of air is very important, because without that, we would not understand about these terms. So, let's begin by understanding the composition of air and what are the partial pressures of different gases inside the air. The biggest is nitrogen, which is inert gas, around 79, and then is oxygen, of course, and then carbon dioxide, and then there are mixed gases and water vapor, of course. So the argon gas is one of the trace gases, which is around 1%. So these are the percentages of air we breathe. In the purple is the one we breathe at the sea level in the earth atmosphere, and in the maroon, while the prepared air inside the scuba set, which we take when we dive inside the sea or inside the space station, or maybe spacecraft. So as you see, the trace elements are missing inside the scuba sets and inside the spacecraft. Dalton's law actually tells us that just look at air, that if we take air as 100%, the different gases like nitrogen is 78%, so it will exert 78% partial pressure, and that of oxygen will be 21%, and that of trace gases would be around 1%, and carbon dioxide, of course, 0.03%. Now you can understand clearly these are the percentages of the component gases of the air, and exactly what are their percentages are exactly equal to their partial pressure, as you can see side by side as I have put them. So that is what, in easy terms, is the Dalton's law. But the hyperbaric therapy works on Henry's law. In the Henry's law, the amount of any gas that will dissolve in a liquid at a given temperature is directly proportional to the partial pressure of that gas. So if the solubility H is equal to directly proportional to the amount of pressure is exerted. So the more the pressure exerted, the more the gas will dissolve inside the body. So the gas is dissolving inside the cells of the human body, which are in billions. So now coming to the topic of hypoxia and anoxia. Anoxia is the total absence of oxygen, but hypoxia means that the percentage of the oxygen would vary. 95 to 100 is normal, 90 to 95 is mild, 85 to 90 is moderate, and less than 85 is severe hypoxia. So that is the difference between anoxia and hypoxia, although some people would use these terms, but now you understand what they mean. Hypoxia affects the mitochondria, Mitochondria makes the energy of the body, like it makes ATP, which are the energy to the body, and without the energy, the cell dies. In hypoxia, if it is below 1 millimeter of mercury inside the mitochondria, the oxygen, it will not be possible to make this energy, and hence the death occurs because of hypoxia. So these are the signs and symptoms of hypoxia. There are 11, and restlessness, headache, anxiety, rapid heart rate, rapid breathing, difficulty in breathing, slow heart rate, extreme restlessness, bluish skin, confusion, difficulty in rational decision making, just like what happens when you climb these tall mountains. Hypoxia signs and symptoms at different partial pressures. On the left, there is the percentage of the oxygen inside the human body and the y-axis. On the x-axis is the partial pressure of oxygen, like it is 21, 0 to 21. And at the bottom is the altitudes. At the bottom x-axis, the altitude in feet is shown with corresponding partial pressure of oxygen. The opposite of hypoxia is hyperoxia. So hyperoxia is actually defined as when the tissues and the body organs are exposed to excess of O2 higher than normal partial pressure of oxygen at pressures greater than normal, like in the chamber, it will cause hyperoxia. And hyperoxia will not lead to something bad, but if something bad happens, we call it oxygen toxicity due to oxygen radicals in the human body. So then we call it oxygen toxicity, and it's divided into two types, the pulmonary variety and the CNS, central nervous system variety. Usually, if you are exposed at 1 atmosphere for 12 hours, you can have oxygen toxicity of the pulmonary variety, or 2 atmosphere for 4 hours. Similarly, the CNS variety at 1.380 in the wet diver, like under the sea, and it can be 2.4 or 3 when dry. So now I have explained about hypoxia, anoxia, and hyperoxia, which leads to oxygen toxicity. So now I would explain what are the signs and symptoms of oxygen toxicity, what are its immediate signs, and what are its delayed signs. So if you know the immediate signs, you would immediately stop taking the extra oxygen and try to avoid the oxygen toxicity. So let's begin. So the signs and symptoms, you would see that in the eyes, muscles, in the brain, and the respiratory system. But these signs and symptoms varies individual to individual. So I have actually, for the ease, have divided into immediate symptoms and the delayed symptoms, because when you are diving, there's you have to understand, or when you are inside the chamber, what immediate you can have, like pain and burning sensation while breathing, coughing, jerky breathing, and shortness of breath, muscular twitching, seizures, and epilepsy. So these are the dangerous signs you should look out for. The delayed are tracheal bronchitis, visual field nearsightedness, bleeding of eyes, fibrosis, cataract, ARDS. The individuals react differently to oxygen toxicity. Some would have it quickly and some would have it later. But hypothermia and low temperature will cause it to come sooner. Immersion in water, like wet situation, will make it sooner. As well as the depth, like if you are very deep inside the water, the oxygen toxicity will come quickly. And intermittent exposure, like if you do multiple dives, or you are multiple times in hyperbaric chamber, each dive would add on to the having oxygen toxicity quickly, even if you are in the safe zone. CO2, the more CO2 retention inside the body, it will be quicker. Hypercapnia. And exercise, inert gases like nitrogen or helium can also cause the oxygen toxicity to come quickly. Now I have explained about the oxygen toxicity sign and symptom. Let me tell you about its treatment. The options of its treatment are as follows. The treatment of oxygen toxicity is actually none. So the only way is to avoid it, because if the diver is not careful, the damage is permanent. So if under the sea, ascend immediately, and if breathing a mixed gas, reduce the partial pressure of the oxygen, and if inside the chamber, immediately remove the mask. But when you do this, actually it will take 2 to 3 minutes for the sign and symptoms to go away. So you would only know after 2 or 3 minutes that the oxygen toxicity has gone. So do not panic and be relaxed and do these measures to get rid of oxygen toxicity. I hope you enjoyed my video. I want you to like my video and also subscribe to my channel for such informative videos about hyperbaric medicine, which is very rare, and I'm one of the very few doctors in the world who is trying to explain about hyperbaric medicine, which is completely new. So I hope you subscribe to my channel. Take care. Goodbye. See you soon.